Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined by Alex Lutz, our VP of Marketing and Public Relations, as well as Dr. Francesco Rotatori, our Chair of the Cardiovascular Department, and Dan Ryan. He is the Senior Advertising and Marketing Director here at the Staten Island Advance. Welcome. Through RUMC Connections, you will meet the fantastic doctors, nurses, medical professionals, and partners that make our hospital thrive. On our show, we will also provide you with useful information about maintaining your own health and hopefully get you answers to some of your own medical questions. And we could not have a more perfect guest for our show today. Well, I think this is a perfect opportunity for Alex to tell his personal story to everybody on how you began at RUMC as a patient and eventually made your way to Mount Sinai, if you'd like to share.
Sure. In the interest of heart health, I myself, I had a triple bypass surgery. It'll be May 13th, be almost a year. And it started, thanks to Dr. Rotatori, really. I lost my brother in March. He was 46 years old. He had what's called a widowmaker heart attack, which I think is the most severe kind of heart attack. No symptoms, no history of any kind, and just passed away. So when I got back from Georgia with Dr. Rotatori, he ordered a CAT scan with contrast. So a lot of my story he's already talked about. It revealed blockages. I remember he called me that afternoon. He was running the Boston Marathon. He called me that afternoon and told me the news. And then a week later, he performed angioplasty through my wrist, found the blockages, and told me I needed triple bypass. He referred me to Dr. John Puskis in Mount Sinai, who is the chair of cardiovascular surgery. And he basically had my heart on a screen, and he showed me the blockages, told me what we're going to do. Very matter-of-factly, scheduled it. So May 13th, Friday the 13th, actually, I went in and had a triple bypass. It was a 6-hour surgery. They basically took a small incision, which you can still see on my wrist, cut it in half, did 2, moved another artery over, and I was out of the hospital 6 days later. Amazing. So far, everything has been great. Back to working out, running 5 miles, lost a lot of weight. I don't recommend it as a weight loss program, but it works. It works. Everything has been great. Even my blood sugar is lower than it was pre-surgery. So it's one of those things that, thanks to Dr. Rotatori, was caught very early because it was a couple of weeks before I went to Dr. Rotatori. We ran the 5K for RUMC. And I had no chest pains, no shortness of breath. I was working out 4 days a week. It's a game changer. You know, I'm someone who's never had a cigarette to my lips. I don't think I'm overweight. Scale may say otherwise. Working out 4 days a week, running 5 miles, and then to be told you had 3 blockages, it's game changer. I say I owe my life to 3 people: Dr. Rotatori, Dr. Puskis, and my brother.
Absolutely.
So, doctor, for me, I've always seen Alex and perceived him to be a very healthy person. Even, some of our sanity that we kept during the pandemic was Alex would, we would FaceTime back and forth, and he would challenge me to do push-ups for some cause, some internet sensational thing or whatever. For me, I looked at a guy who ran, lifted weights, and personally, I'd be like, I could go do push-ups out. Like, great. Now, thanks, Alex. But is that part of the genetics that you talked about earlier? Is that one of the factors of things of how somebody who's in such great shape could actually then have these risks and potentially these things that we don't even know that we're not feeling, right? You didn't have any pain?
No, I had no shortness of breath, no chest pains ever. Like I said, we ran 5Ks. I'd run 5 miles on the weekends. I'd work out 4 days a week for about an hour. Tended to watch what I eat. Never had a cigarette to my lips. It was not something that, my family never thought about it. My father, we were worried about diabetes. My father had diabetes. His brother had diabetes. My grandmother had diabetes. And my father was exposed to Agent Orange when he fought in Vietnam. And is there a connection? Who knows? Who knows what Agent Orange? But our concern, my brother and I, were always, we didn't want to get diabetes in the sense of, my father had amputations of his extremities. He had quadruple bypass, and ultimately he passed the age of 60 from a massive heart attack, blood-on arterial sclerosis. But we always connected it back to diabetes. We never really thought of anything else. And that's why it was when my brother passed, it was this shockwave. And I remember my mother even saying to me, she's like, go for a workup, but you're going to be fine. When you work out, you've never smoked, all these things that your brother did that you didn't do. And then lo and behold, I need triple bypass. shockwaves through my family. And everyone went for tests. 2 of my cousins are now on medication because their cholesterol was through the roof. It really makes you evaluate. And like, we started to think, like, how many people are out there that don't know because they don't have symptoms? They think they're healthy, but they don't know because it goes to genetics. It's something that they can't control. And then you find out about it. And, you know, it was very funny because Dr. Puskas, when he first was interviewing me at Mount Sinai for my surgery, he said, well, you know, he says, technically it's an elective surgery because you didn't, you know, and I'm like, it's not really elective, you know, because he was joking about how during the pandemic, a lot of elective surgeries were canceled. But he said, listen, this is what we're going to do. And it's really amazing when you see, I mean, you think about the fact that I didn't have it laparoscopically, cracked my chest open. You're asleep for 6 hours, probably the best sleep you're ever going to get. And then you wake up and you hear people calling your name and you're intubated and you can't talk, which always makes me laugh because they're talking to you. They want you to respond. They can't. But you think about the fact that it was 6 hours of surgery and I woke up at 7 o'clock that night and 2 hours later, I'm watching the last 3 innings of the Mets game. And I'm talking to nurses and I'm not in any pain. I'm not in any, that was I've always had respect for doctors and nurses and medicine. When you're in that position, when you can't lift your hand and someone has to move you in a bed, that's when you really realize just what a great job these people did. It's wild.
So going back to your question, and it's true, this is also a big part of what the whole research in cardiology is going towards. But the reality is that, yes, genetics plays a big role. That we know that. And we know that some people probably, despite doing all the things wrong, they're never going to have a heart attack. And some people, instead, that they do everything perfect, they will have problems. So, but what we have in our hands nowadays, and we do have some tools that can help us at least finding out before everything happens that you are one of the person that probably has a more aggressive disease than others. And one is the lipid panel that we were mentioning before. And also there is other couple of tests. One I mentioned briefly is a calcium score. Calcium score is a test, is a low radiation CAT scan. So it's like a CAT scan, but with very low radiation. And basically what it does, it measures the amount of calcium, very simple test. Measure the amount of calcium that you have around the heart. And it comes out with a number. It goes from 0 to 1,000. Why is that important? Because every time you have started having deposition of cholesterol in your arteries, you bring some calcium. So there is a linear relationship between the amount of calcium that you have and what we call the atherosclerotic burden that I mentioned before, how much plaque you have around. So, and I mean, the idea is that there's a claim that sooner or later we're going to say to everyone that is reach age of 45 or so to get a calcium score and see. If your number is 0, then that means that virtually there is a 99% positive predictive value, the 99% chance that you're not building up cholesterol in your arteries. And so that at least is a big, I mean, it's a good thing to know. However, if your numbers is 100, 200, 300, then we know that something is going on. And so we know that we have to be extra cautious. We have to have extra attention. We have to, for instance, if you go to, I have a lot of patients that come to me and say, oh, I went to my doctor, they always told me that cholesterol is good. Now, when I look at their cholesterol, what we, as cardiologists, we perceive as good is not what other doctors perceive as good. And if you look at the guidelines, the European guidelines, they say, for instance, that your LDL cholesterol, the bad cholesterol, should be below 55. Most of the people people are happy with a cholesterol level LDL of 110, which is double than what it's considered fine in the European guidelines, and soon it's going to be changed to American guidelines too. So there's a lot of aspect of genetics that we're learning, that we are able to detect, and that they will bring to more aggressive treatment. So, of course, Alex's story is very unique, but it is also true that his is a story that helps us, that tells us basically that should be checked. So that everybody be checked after a certain age. I definitely think so. Is a lifestyle important? Absolutely, it is. It's not just genetics. Lifestyle is important. He does very well with the surgery that he had, also because he's a very active person and very good shape and so on. And if he wasn't, he might have had more problem than what he did have. And so we're not here saying, it doesn't matter. I mean, it doesn't matter if you're done, if you're not active. It does. It matters. Makes a huge difference. On the other hand, if you know that your genetics are bad, then probably it's even more important. So probably it's and red flags should be looked much more carefully.
So what led you to medicine and cardiology?
That's so my father is a cardiologist in Italy. So I always thought that I wanted to be a cardiologist from day one. Even, when they asked the secret question, what was your job as when you were a child, was cardiologist. Yeah, so now you guys can get my but yeah, I always wanted to be a cardiologist because I was seeing the passion that my father had in his job. The funny story, though, is also that he was doing a lot of nights and working a lot of nights. And when he was going to work, he was going to, being on call, in Italian, when you translated, basically, my dad was doing the night. And I was actually thinking that he was literally making the night happen. So for me, it was like a very cool job. I'm going to go and make the night happen. It was putting the night. But anyway, besides that, I always had this idea that I wanted to be with people. My job had to do with people. And then by testing it, doing some internships or so, and I realized that being with people, especially in the moment of their dearest need, when they're in difficult times or so, is what I felt I was called for. I have a lot of passion for people. And then of course the rewards when we save a life, it's amazing. But also the rewards of knowing that people rely on you, people think of you as someone in the family. I have like a family of thousands of people because everyone thinks I'm a family member, and to me that's what makes my life worth it and makes my many hours of work worth it. Yeah.
Right. I'm very curious. What drew you to Staten Island from Italy?
That's actually I guess from Italy to Staten Italy. No, and it's actually it was just a chain of events that were unpredictable. When I first came to the United States, I came to do research, and I started in 2005 my research. But the research on stem cell, that's what I'm mentioning, started in 2000, and there was this big claim that there was this lab that was capable to regenerate the heart. They get a heart that is failing, we're just gonna inject stem cell, the heart is gonna regenerate. That was a big claim. So of course, when I started seeing this, I got fascinated, and I found a place in New York when they were doing this study. So I came to do that research. The research didn't work as good as I wanted to be. That it ended up being that we're not nearly close to regenerating the heart. And in the meantime, this 2 years away from patients and staying with other lab animals, I felt that this was not my goal, and I wanted to go back into medicine. And so I applied for residency program. I took the boards. When you come from another country, you have to restart all over again. So I took my test, and then I applied for residency program. Although I was a really cardiologist in Italy, I had to start from scratch here. And it was like a late moment. It came out that I got an interview at RUMC. And I got an interview exactly when RUMC was born. At the end of St. Vincent and RUMC was born, that's where I started my residency program. So then I stayed there, and then the rest is history.
So when we talk about physical activity, what a lot of people probably don't know is you are an accomplished runner. How many marathon races would you say you've run in your life?
11.
11. Okay, what's your fastest time?
So my fastest time was the 3 years, almost a year and a half ago. I did 3:04 in the New York Marathon.
There you go, yes.
But
3 hours.
3 hours.
I was not expecting.
How do you prepare for a marathon? How do you prepare for a marathon?
So it's the same way as you prepare for life. So It's true. I feel that marathon explains life very well. You basically have to commit to something and you have to do it. And there are days that you don't want to do it. There are days that and the days that you fail, days that you don't go. But at the end of the day, overall, you need to be consistent. I don't have the chance, and my job doesn't allow me to, and my job and family doesn't allow me to train in a super consistent way. I don't train 5 days a week or 6 days a week like all the good marathon runners do, or 7 days a week. If I can do 3, that's more than enough. But consistency throughout the year. And I mean, first of all, I like it. Because I have a lot of people that ask, how do I go to running? I mean, I don't like running. Like, we just don't do it. I mean, I don't know what to do. I mean, you have to like it. I mean, you have to enjoy it. It is true that the beginning can be a little difficult. So a little bit of motivation in the beginning. But when you start seeing the effect of running, what running does to you, the running high, I don't do drops. The running high is really true. I mean, you have a sense of well-being. You have a sense of accomplishment. Finishing a marathon is one of the best experiences I had in my life. And even when my time is not the best, crossing that line it's an amazing experience. It's just a matter of commitment. It's you have to put your time, and you don't see the effect of what you're doing for a long time. Like run. I'm gonna be able to do it, and then the marathon comes in like a month before. You're like, I'll do it next year again. Do it, and it's a great accomplishment.
Any budding runners or cardiologists in the family?
Yeah. So my dad is a marathon runner too, and he's my dad is like a little older version of me basically, and so he's now 74, so going to 75, and except for a minor surgery that you'll have to have soon, he's probably gonna run his next marathon next year.
What's the oldest runner? Do you know?
I mean, they have people in their 80s that they run in student matter. But again, it's a matter of commitment. The one foot after the other, and he makes 42 kilometers over 26 miles. Yes.
Are you training for any marathons this year?
Yeah, I'm always training because I always try to find a way to come up. I should go to Boston again in April, but I've been a little delayed lately. Too much jump to them. But I'll hopefully I'll do it. I'm on for New York again. I mean, this is gonna be my 10th in a row for New York, so I definitely do New York. Yeah.
Wonderful. In our final minutes together, maybe you can tell us a little bit about your colleagues in the cardiovascular department. I know we have a team of experts in many areas of cardiovascular care, so would be care to elaborate a little bit about them.
Yes, of course. So, and I'm actually very excited. I'm glad you asked because really my department is it's growing and very fast. In fact, we have one of our cardiologists coming on board in July, so as soon as he finishes training, but we have already committed to come and join us. But it's me and then the two people that started a couple of years after me. It's Dr. Galligan, Dr. Sean Galligan, interventional cardiologist like me. He does the plumbers like me, and he's a wonderful guy, trained downstate with me. So when he finished his training, I knew him already very well. Very passionate. I mean, I'm Italian, he's Irish. We have perfect combination. And
good poppers, yeah.
Absolutely. He's probably better than me. But yeah, you see me, and he's the Irish version of me. Like very, very passionate with patients. Very, very passionate with patients. And then Dr. Shehai, she's an excellent cardiologist. Again, she trained at downstate. I know her very well. She came in. And if Sean is passionate with patients, she's like 10 times more passionate with patients. Her patients are like, they love her. And she's very, very, not only they're passionate, they're also very knowledgeable. I mean, and that is the perfect combination for a good cardiologist. They were the first two joining me. And then a couple of years later, we added Dr. Tite. Dr. Tite, again, exceptional interventional cardiologist, also with knowledge in other aspects of cardiovascular disease that we haven't touched today, of course, because this is the heart month, but he does also peripheral vascular disease with particular attention to veins. And so this is something that we offered in our program. And again, exceptional, and very happy with having him on board. And after that, because of what we got busy, we were talking about before, we had a nurse practitioner, Marissa, who's really incredibly committed to her patients. She had a training experience in the emergency room, so she knows how to deal also with people in their sickest time. And then she got a passion for cardiologist. She saw me working. She came on board, and you will have to come and see now our lab, our office. We have dedicated people. Everyone in the office, starting from whoever answers the phone, has a commitment for the patient. Alex met some of them, of course, but the idea is that we go out in the community. We did a lot of community events. We did a lot of screening. We really like what we do. We are very knowledgeable. And so I'm really proud of my team.
Absolutely. But I'd like to thank you, Dr. Rotatori, for joining us today. Thank you for all that you do for us and keeping us safe and healthy.
Thank you. Thank you.
Absolutely. And in closing, if you have heard, we employ highly skilled, experienced board-certified physicians that can serve you at our state-of-the-art facilities in Staten Island. If you'd like to contact our cardiovascular department for an appointment or to learn more about our services, you can call us at 718-818-7425 or visit our website at rumcsi.org. And speaking of running, like we were chatting with you about, on Saturday, April 1st, RUMC will host its annual Arnold Obey 5K. It is a run or a walk, so you're welcome to join us. It benefits our Wayne Sena Neonatal Intensive Care Unit. The event will be held at Clove Lakes Park, and if you'd like to register, you can do so by visiting rumcsi.org/5K. RUMC's Wayne Sena Neonatal Intensive Care Unit has a survival rate of over 99%, which is actually one of the highest rates in the nation. And your support is needed so we can continue to save young lives and keep families together. So if you can, we'd love for you to sign up, participate, and join. One other event that you can look forward to is May 22nd. RUMC will host its annual Jack Sip golf, tennis, and bocce outing at Richmond County Country Club. For more information and to reserve your tee time, court time, and dinner tickets, please visit rumcsi.org/golf or call 718-818-2106. That about does it for this episode of RUMC Connections. Thank you for joining us. I'm Meredith Gaskins.